All right, well, it is 12:04, so we are going to get started. I am excited to see so many people flooding into the room. Let me just say happy Black History Month to all of our beautiful African American brothers and sisters, all of our allies, and everyone in the diaspora. We are so glad that you are here. Welcome, welcome, welcome. If you're just now joining, welcome, welcome. Now, before we get started, because we only have 1 hour for this in-depth conversation, I did want to just do a couple of things. The first thing I wanted to say is that community is really, really important at Comms Noir. And so if you have not already, let me see if I can advance a couple of slides here. If you have not already joined the network, pop on over to commsnoir.com, click on join the network. We're experimenting right now with a free membership. So right now it costs you $0 to become a part of Comms Noir. So go on over there, click on join, add your name to the list, join the mailing list, follow us on LinkedIn. This is a short-term opportunity. So if you will do that, we would love to stay in contact with you. We are so glad that you are here. Shout out to all the aunties in the room who came to support, all the colleagues, all of our community members that are here. Go on over there and join the network. My name is LaTroya Hesser, and I am the founder of Comms Noir. I'm very, very excited to be joined by my co-founder, Belinda Gatson, who's in the room somewhere. I can't see you, but I know that you're there. We are so excited to create this community for social impact communicators and those of us who are doing the hard work of behavior change and of marketing great behaviors. Many of you in the room are also in public health, not necessarily doing communications work, but we know that a lot of what you do is outreach and working with communicators. So you are welcome to be a part of our community, and we're excited that you are here. So today, I want you to know that we have 2 prizes, okay? So if you stay until the end of this conversation, you will get, for the lucky person whose name we will have to just choose in some other new way, because it was supposed to be straight from the chat, but we will figure that out. I will get a full report on everyone who is here. So we will draw a name of an attendee, and you will get a $5 gift card to Starbucks. Maybe you want a latte, or maybe you want a medicine ball lemonade tea like I do right now for my voice. But we are so glad that you showed up, and we want you to stay to the end. And so we want to show our appreciation by just giving you that prize. Now that is the second prize, but the first prize goes to already chosen Tiara Murphy. If you are here, you were the very first person to register for this conversation. As soon as the email went out, you dropped everything you were doing and you registered within like the first 5 minutes. And I just want to say that I see you, and you will be getting a gift card for jumping in and being a part of this conversation too. All right. Before we go any further, I just want to do a little bit of member bragging, okay? At Comms Noir, we have fantastic members that are a part of our community, and I don't want this whole conversation to go by without you guys getting to know who some of us are. So Sarah Fales, she is our first founding member. I always have to talk about her, but a little birdie told me that you just got promoted, and I just wanted to say congratulations. You are doing a good job. We see you. You are awesome, and the world needs what you have. So congrats on that. I also wanted to say shout out to Candace Hall. You just made that new move over to Delta as an associate creative director. But at last week's Open Tab Tuesdays, I was talking to Harold from the LGBTQ Cancer Network. He was going on and on about how you brought down the house with the training. So thanks for representing Comms Noir so well. He says that they are still talking about you in that session. So kudos to you. I just wanted to brag on that. And then lastly, Anna D. Taylor, I don't know if you're in the room today, but she's also one of our Elite Noir members. Now, as such, when there are opportunities that come up for contracts and trainings or whatever it happens to be in your service wheelhouse, we always give you a call. And Anna, she came in to work with me as we did some trainings for a women's health organization, and it was in a clutch. And I'm going to tell you something, you all. She did this in-depth training on grant writing and proposals, and it was so detailed and so good. I'm usually the first one to run away from having to write yet another proposal. And she broke it down in such a way that I was like, all right, we'll do this again. We'll go after that money. 500 million, she knows what she's talking about. So kudos to you, and I just want you to know that they are already asking about consulting with you a little bit more. So congrats on that awesome training. All right, the last thing I want to do is just make a few announcements. Coming up February 28th, we'll be doing a webinar, online training for those of you who want to understand how to utilize AI in your work, especially as it relates to your social impact work. I'll be bringing in Keontae Key, and we'll be talking about how to use AI and coupling that with the Belong model. So if you guys were at Catching Tones, you know about the Belong model in terms of her approach to it. And so we'll be using AI to level up our work, make our work a little bit easier, but also showing you how you can do it with your social impact work. On March 1st, for those of you who are in Atlanta, we are having an in-person co-working day. So it'll be a lot like Open Tab Tuesdays, but there's no agenda and we'll be in person. So if you just want to come, spread out, bring a lunch. If you are an Elite Noir member, of course, lunch is taken care of. I hope to see you just to hang out, just to get to know. You never know what kind of partners and resources will be shared during that time. So we'll be there all day, and you'll get an announcement about that in just a couple of days. And then I wanted to say that in April, we have not chosen the date yet, but here in Atlanta, we're going to do our Comms the World Picture Day. So that means these are not regular headshots. We are doing brand photos. So you come, it's free if you're here in the area. We'll find a fantastic location. You'll do some brand photos. Of course, our Elite members, you don't have to pay for the prints, but everyone else, come get your picture taken. You know you've been looking to get some new shots for your website. I know I have. And so we look forward to seeing you guys then. Keep those dates in mind, and just keep your eye on your inbox. That's really all I have. I want to hand over the mic to LaShondra, who, by the way, this is her entire brainchild. And so you go ahead and take it away, and we're just so glad to be here.
Thank you. Well, welcome everybody to our webinar. This is the role of social marketing in promoting Black health and wellness. Yes, happy Black History Month to everybody. I am your moderator, LaShondra Cordier. Thank you, LaTroya, for that introduction. Just for everyone's understanding of who I am, I'm the Senior Director of Mental Health and Substance Use Disorder at Forrest Marsh. And Forrest Marsh is a company that brings together the science of research and the art of communication to really look at human behavior and design solutions that influence decision-making and move people to action. So we're impact and social oriented. So for nearly 20 years, I've worked in public health. I've served as a federal health communicator, a leader, and a trainer for almost 15 years within that at the CDC. My focus is health behavior, environmental health, risk communication, and injury prevention. And public health really is a passion of mine. And that's one of the many reasons why I put together this webinar and why I'm so honored to facilitate it with three women that I hold in very high regard and have worked with in the past. So we are going to be talking about improving well-being of Black communities through social marketing and health communication specifically. And I can't think of a better group of people to do that with. So before we get into the discussion, I want to introduce all of our speakers. I'm going to start with LaTroya, who you just heard from. LaTroya Hester, as she mentioned, is the founder of Comms Noir. She's also the former director of communications for the Center of Black Health and Equity, and she continues to prioritize issues related to Black health. She, like myself, is a UGA graduate, so go dogs. She's worked in, double dog here too. So she's worked in loyalty marketing, brand management, public relations, and health communications for more than 20 years. And she currently manages the Center's State of Black Health National Conference and is the visionary behind the organization's Truth Check campaign, which addressed COVID-19 misinformation. LaTroya is passionate about teaching and training and runs Media Woke, which is a faith-based program that teaches media life discipleship. And full-time, she serves as a life coach to two little girls who I hear have plans to take over the world, which makes me very much think Pinky and the Brain every time I see it. So I'm looking forward to them running the world one day. We need the help. Next up, we have Dr. Ashani Johnson-Turbis. Ashani is the Vice President and Director of the Center of Equity Research, which is a multidisciplinary center in the Bridge at NORC at the University of Chicago. The center advances equity through development, implementation, and dissemination of high quality, inclusive, and equitable social science research and methods. She's an experienced and award-winning social scientist. She also has over 20 years of, in conducting communication, social marketing, public health, and public policy research. That includes the measurement of communication messages, materials, and campaigns that all promote equity. Ashani blends her academic background in political science, political behavior, and public policy with years of work in public health, health communication, and evaluation, which is where I met her. She has degrees from Hampton University and Purdue and serves on the board of Black Health. She's an adjunct professor at Emory University, Rollins School of Public Health, for those of you in the Atlanta area, and is the president for the Society for Health Communication, which is another organization I encourage you all to join. Also on our panel today, I'd say last but not least, but we saved the best for last around here. We have Siobhan Reed. Siobhan is a highly acclaimed, internationally traveled speaker, award-winning entrepreneur and marketing executive. She's a trained journalist and has published many thought leadership articles and hosts the Future Health Now podcast. She has expertise across e-commerce, health maintenance organizations, mass media, digital media, government agency and program implementation, communications, dental and medical device manufacturing, which was I learned that new today, employee engagement and marketing and sales. And Siobhan is the founder and CEO of OPUA, which stands for Optimistic People Unified for Awareness, which is a Gen Z targeted health and wellness company that focuses on chronic disease prevention and health promotion. Siobhan is passionate about spreading the importance of healthier lifestyles and generational health, and she is our last panelist today. So welcome all of you ladies for joining us today. And now that you have a bit of background about all of us, I want to get the conversation started since we have an hour. And I'm hoping each of our panelists can share a personal experience as a Black health communicator and any unique challenges or opportunities they've encountered that impacted their work or focus. And I'm going to start with Siobhan since I read her bio last.
Awesome. Thank you so much. I'm so excited to be here and share this honor to be here and just share with you ladies. I love each one of you. I will say that health comms really is very personal for me. I really pivoted into health communications after some very traumatic experiences on the personal front. My mom suffered from several chronic diseases that were preventable. And as we emerged into the pandemic, I saw that my two daughters, who were teens at the time, were just kind of struggling mentally and with the whole isolation piece. And so they started to retreat and not really get out and be as active as they were. They were both involved in sports. They were literally doing nothing. And so I said, well, we have to do something to change this because we can't let this be the generational narrative that continues over and over. How are we in 2021, 2022, 2023 and still having, the statistics show that marginalized communities are suffering more from cardiovascular disease, from diabetes, having to have amputations done because we're in advanced medicine. And so that is really the core of my why. I really wanted to center in on why we need to focus on our future health now.
I think that's something that resonates with all of us who have kids and those of us who have older parents or grandparents and experiencing that, seeing that firsthand. So thank you for that. Ashani, you want to talk about an experience in your perspective?
Yeah, I so appreciate Siobhan's response, her transparency and vulnerability in her response. I love it. My answer to this question is there are two challenges that I want to share, and one is specific to my experience being Black as a Black health communication scientist, and the other is less specific to just being Black, but working in spaces to promote and advance Black people's wellness and health equity. So the first challenge I want to share is that a big challenge for me had been entering early on, especially early on, was entering spaces where so few people looked like me. So, or shared my interests in conducting work that was focused on advancing equity for all people and especially Black people. So early on, I found that I was the only Black health communication researcher in many spaces. And that was a challenge because it felt kind of lonely. But I also saw that as an opportunity. So an opportunity, one, to bring up issues and bring up things that others may not bring up who were in those same spaces just because I had a different lived experience, so I could bring up things. And then also it became a wonderful opportunity to bring other BIPOC people, especially Black people, into those spaces. The second challenge that I want to bring up is less due to my Blackness as a public health communication scientist and researcher, but more due to my interest and commitment to bringing attention to Black culture and community on health communication research projects. So in the past, when I endeavored to bring up issues or raise issues of conducting research to tailor health communication messages and materials to be focused on people of color, especially Black people, I encountered sometimes ambivalence from colleagues, sometimes hesitancy, and sometimes just outright like rejection. That has changed, and I'm so happy it has changed a lot in recent years. And as people have become more aware of the need to embed the lived experience of populations and people under inquiry into the work that they're doing. So that has provided an opportunity to do that, and in addition to really use culturally responsive research approaches, like culturally responsive and equitable evaluation and research in the work that I do. And that's been very evident on multiple different sorts of campaigns, message and materials development projects that I've worked on over many years. So those are two key challenges.
Thank you. And we're going to talk about that second one and some of those opportunities a little later in our discussion today. So I appreciate you sharing that. LaTroya, do you want to give us a share?
Sure. So I'm going to try not to talk about the tobacco industry too much today, but because so much of my experience and background has been in tobacco work in terms of public health, I can't help but to bring that to mind, especially now that we're looking for a ban on menthol. And these issues really do impact Black communities differently because we've been targeted differently. And I think that the challenge is because, as Black people and as being a marginalized community, racism is an extremely real and extremely visceral part of our experience. And it's really easy for entities like the whole tobacco industry to co-opt our messages and use certain things against us. So we have to be really aware of it. I think that's a huge challenge, that sometimes we're just not aware of, what's happening around us when media frames certain messages a certain way. We're not always thinking about where those messages come from and who has to gain from those messages. And so that's a challenge because it's a sensitive area for us. That also means that we have to be willing to put the budgets, which aren't always allocated for issues related to our communities, and the energy and the resources to tackling those issues. But the thing is, a lot like what Dr. Ashani was saying, is that as Black people, our Blackness is an asset. And we should be able, and I feel like right now, we are more and more able to leverage our Blackness to communicate more accurately and with more precision to our own communities. And I think that because we're all so diverse, there are certain aspects of our Blackness that I find to be hugely advantageous for me, or just really thinking about just like an area of an opportunity. So I think about myself as a preacher's kid who grew up in the Black church context, right? And so when I was the director of comms over at the Center for Black Health and Equity, we launched No Menthol Sunday, which was really a way for us to get into rural Black churches that, the CDC couldn't reach all by themselves. You'd have to know where the dirt road churches are. You'd have to know those people who are really good at organizing community health workers and knocking on doors and understand the language of the Black church, right? Using your own experience as a cultural asset will do us well when we're having to meet some of those challenges, when we don't always have the budget, we don't always have the attention we need, we don't always have the literacy around media messaging. But I think that, that is the challenge, but the opportunity is for us to see ourselves and our own experience as an asset to really tackle those issues with more creativity and with more effectiveness. And I feel like No Menthol Sunday is just one of my favorite campaigns. And it's just a quiet giant that was really able to help educate folks about the role of menthol in tobacco addiction. And so I feel like, that's my response to that. My response to that truly is that we have the opportunity to leverage our own Blackness.
And I think it's so true. And I think resonates even in my own personal experiences in spaces where maternal and child health issues were cropping up, and recognizing I was the only person kind of advocating for those things and creating prenatal programs. But also we see that in the substance use disorder space across the whole. So tobacco is a great example, I think, of where leveraging us as assets and leveraging our knowledge and our representation to really bring messaging that's impactful is really important. So thank you for that. All right, so our first real question is, I'm going to start us off with, is considering it is Black History Month, so we're going to consider the historical context of health communication and African Americans. So keeping that in mind, how have past narratives and approaches really influenced current strategies in promoting Black health? And I'm going to start off with Ashani for this one.
Okay, this is I told LaShondra in advance that this is such a big question. So it's a big, heavy question. And you will bear with me as I go into a little tiny bit of professor mode on this one, and as I respond. And that is, so I think that past narratives and approaches have endeavored to build cultural sensitivity into health communication research strategies and interventions to promote Black health. However, I think they focused on what Dr. Ken Resnick would call surface structure issues. I read this article, and I know that it's from 1999. I looked it up in advance, that had such an impact on me in doing health communication research and understanding the difference between surface structure and deep structure. So I think that past approaches, like as past narratives, I think an approach is focused on cultural sensitivity, yes, but focused on surface structure. So surface structure refers to matching messages and strategies to superficial or observable characteristics in the Black population. So for example, focusing on things like having images of Black people, of putting places, of language, of foods that are preferred by Black people, putting that in health communication messages and materials. That's important. That's good. Representation is important. I can't even remember the Viola Davis quote about representation, but I'm going to remember it and say it probably at the end of this. But one problem with that is that Black people are heterogeneous, right? So especially with changing United States demographics. So music and food are different in different places. Another problem with these past approaches is that they may have helped people be receptive to messages, but they did not necessarily engender or rise to the prominence in a community to motivate change in health protective behaviors, right? Or behavioral change. The lesson is that we need to focus on deep structure, what Dr. Resnick will call deep structure issues related to culture, social, historical, and psychological forces that influence Black people's health behavior. So surface structure often or commonly will increase receptivity or acceptance of a message, but attention to deep structure issues. Let me give you some concrete examples. The historical trauma of enslavement or of Jim Crow, or of wealth disenfranchisement, like, right, being attentive to those sorts of issues in one's messages about health, that can make health communication, messaging, and interventions far more salient for people, especially historically marginalized and minoritized people, to motivate people into action. So that is my long answer, a little tiny bit, not super, I hope, tiny professorial in response to what I think is a big and exceptionally good question that you asked, LaShondra.
Thank you for that answer, and I appreciate your professorship. You touched on something that I think we often see a lot in other minority populations or marginalized populations, like when you think about Native and tribal institutions and organizations and communities, they talk a lot about that trauma and how it impacts receptivity of message, how it impacts engagement with that community. And it's something that we are often taught to do for that group of people that we don't often, I think, apply to African Americans as well, that I think we should. Like, we talk about enslavement, we talk about the trauma, we talk about political determinants of health and how social determinants of health are also influenced by the life we live. But there is this space of, like, sometimes we have to unpack that trauma to be able to have clear messaging and effective messaging and really do that. And in that surface level is a very interesting concept that we're kind of, I think, shifting direction now to recognize that there is more than what sits on the surface. And it's more than just having images and representation that look like us. It's understanding our populations and understanding
Right.
their differences and the regional aspects of that, so we can really have impactful and effective messaging. So I appreciate that.
Yes, that's so important. Can I just say one thing? Because I remember, because I found where I
Yeah.
wrote down the quote. So deep structure, all the things that you just mentioned, critical, that deep understanding of people, especially historically marginalized and minoritized people, and trauma that, and in messaging and material, it's important not only to, you have, it's like a fine line, right? Because you want to address trauma experienced by populations, systemic and structural trauma, but you also don't want to re-traumatize people, right? So it's sort of, it's a fine line to walk. But I will say that even surface structure issues are still important because, to quote Viola Davis, you need to see a physical representation of your dreams, right? That is important in our messaging and in health communication interventions as well. Okay, I'll be quiet.
Well, and I think we're also seeing it in all industries too, right? But your
Yeah.
Viola Davis quote is great, entertainment industry, but that's also, you know, another example of where we need to see that representation across the board. But others want to comment?
Well, I will just say that I think what often happens, and I think we saw this a lot with COVID-19, is that there was, for instance, acknowledgement of past trauma with Tuskegee. And instead of approaching the Black community, I feel at first, the messaging was like, yeah, this happened, but, right? And so we were seeing constant, all this vaccine hesitancy because of legitimate history, right? And I think that on the onset, a lot of the COVID-19 vaccine messaging was centered on yes, but. Whereas I think that a better approach, and one that we took in some of our campaigns, was to say, this happened and you have every reason to be hesitant. So instead of asking us to get over it, you have to recognize that this is much more deeper than just a historical thing that happened, but this has framed the way we see the world around us, and it has framed the trust that our communities have, right? And so what we didn't want was people to ask us to ignore the evidence that we have to mistrust, right? And instead we said, yes, you are right, this did happen. And all the campaigns then should be centered more on, and for that reason, you should be as skeptical as possible. So a much more affirming message, affirming who we are. And so, for instance, when we were creating toolkits for American Lung Association, we had an entire campaign centered on the idea of, yes, be skeptical. Instead of saying, get over it, it's more of, when in your skepticism, here's where you do the research. And so instead of asking us to put our history aside, which I think is what often happens when we're talking about slavery and all of that stuff, we should be not centering it so that you don't re-traumatize folks, but certainly acknowledge it with a level of reverence. And that's just something I wanted to say about that.
Yeah. And thank you. And I think that kind of piggybacks into where we're going next with this conversation. And it was around kind of taking that concept of trust and that foundation of trust and really leaning into that skepticism. And how do you really address misinformation and dispel myths when you have a community that does have a lot of mistrust, well-placed mistrust, and when we have a lot of skepticism that exists. And you mentioned how you were able to do that with kind of COVID, but would love to have any expanded kind of share on strategies that you found have been effective in kind of building trust in the Black community and dispelling that misinformation in the process.
Sure. I mean, so you mentioned in the bio that we had developed the Truth Check campaign out of the misinformation related to the vaccine and COVID. And the point of that campaign was not really just to talk about COVID, but it's really helping people understand how media messages impact and shape your thinking. One of the things that I always say in trainings is that, there are people who sit in a room and they analyze your demographic, like you were talking about, that surface stuff. And then we analyze your psychographic, And then we think about how we can create messages that will change your mind, change your attitude, and ultimately change your behavior. Now, in public health, of course, we're doing this for social good, but not everyone is after your social good. Not everyone is working toward your good. And so the thought is that if people could be more media literate, really understanding how to analyze messages, they are less impactful when they come in. You can see them coming a mile away, right? And so that's what I would, that's what I think the challenge is helping communities, Black communities and everyone recognize how misinformation gets in. And it's usually by way of passivity because we're not paying attention to the messages. We're not thinking about who created the messages. We're not thinking about what their agenda is, how this message affects us. And so we were spreading it. And I think that in the same way that we should urge people to really reconsider their consumption of social media content, news, magazines, books, music, even music. Like, if we're trying to level up our culture, like, we can't consume everything, right? And so the challenge is in having a really broad perspective about what it means to spot misinformation and refrain from sharing it. And it's applicable across many issues. So we were doing it with a truth check in COVID-19, but we can do it again with tobacco. We can do it again with healthy eating. I mean, there's so much opportunity there.
And I know we saw a lot of that also in politics too, right? It's the space of recognizing, and I think media literacy is a great concept. It's recognizing information, disinformation and misinformation that's coming and not contributing to the spread of it, and understanding how to source your resources and
Yes.
validate your citations and all those things that are coming, and recognizing a good source from a bad source, and recognizing that your neighbor might not always be the best source for medical information, or that
Right.
your, news programming has probably got a different agenda than maybe something else. So I think that's a really great point. I wanted to give Siobhan an opportunity to answer this as well, because I know she deals with this a lot in her work.
Yes, for sure. So mine's is really, really deep because of the childhood adverse experiences that I encountered growing up. So I was conditioned to compartmentalize my feelings. And so I kind of was in a denial about the systemic challenges of racism and other, the whole long laundry list of things that we were really up against. And although I didn't, had the blinders on, or I wasn't woke, my husband very much was, and he was actually living it, right? And so after, George Floyd happened and all the other countless, encounters that kind of came up, I had a new awakening. And so like I was one of those people that were guilty of saying, can we just get over it and move on, because I felt that re-traumatization, right? But then being able to take a sense of and reflect on it, from a different lens to say, okay, now how can I affect change? Which is why I really wanted to, just refocus and say, look, how can we unify and really stand up for awareness? Because some people just don't know. Like LaToya said, you're, in your day-to-day routine, it's passive, you're kind of overlooking it. And then at different instances, you might catch it. Like if you're looking at the Super Bowl and you have those commercials that are for your zone, for your zip code, and you're thinking like, wait a minute, I just saw that commercial, they just changed it over to Black people and it doesn't even match. It's a real huge mismatch. And so being able to see those types of things, and then as the work I've been doing with Future Health Now, interviewing thought leaders that are in the space doing the work, such as, I'm really, really honored to have been able to spend so much time with the leaders over at University of Chicago, Newark, because I mean, if you think about the work that they're doing and how they're trying to refocus and say, look, we need to, if we want these communities to really believe in what we're saying and to trust us, we need to have them at the tables. They need to be a part of the conversation. It's more than just saying, okay, we're doing all these things, but not taking you into consideration. Amelia Burke Garcia has done a really great job of taking a look at how we've historically marketed, health, and now how we are evolving that into today's time with all of the nuances that are now present. Because it's not so much that, we're talking to digital natives. majority of the consumer market are going to be Gen Z here soon enough. And they don't understand and look at things the same way as we did. I mean, they don't even know how to just have to sit and wait to get on the phone call. They're just like so instant with everything, right? So they have more exposure to untruths and misinformation. And so I feel like a really huge part of it for me has been collaborating with and finding the trusted messengers and having those trusted messengers to actually dig a little bit deeper, not be afraid to be transparent, have those conversations about the Henrietta Lacks story, and really just address it, but address it in a culturally sensitive way so that we're not re-traumatizing, the audiences, but informing them, giving the education and the awareness, and then showing them how we're trying to move away from that to mobilize them and to ultimately really, focus on their future health. Because at the end of the day, we're focusing on outcomes. That's what we're hoping to accomplish out of all of this.
Absolutely. And I think you hit the hammer on the nail with Gen Z. I feel like this next generation is coming out of the womb with an iPad and a digital footprint, and they are starting off before they can even talk. And I know, my son's 10, and we've had this experience where, like, when he first started learning how to read real books, and he was always trying to like swipe them, and I was like, no, those are pages, these are things. And so this generation behind him, I'm like, oh my gosh, like, what are we gonna do?
Yes.
And I think that brings up a good question for me in terms of, how do we really ensure that our communication strategies that we're implementing really resonate with that diverse experience and perspective that exists in the Black community? And how do we really have an impact, especially with a generation that's coming behind us that doesn't have that frame of reference? So that's to all of you, and whoever wants to take it first can start us off. But how do we have an impact? How do we ensure that our strategies resonate?
So I'm going to go first. So number one, I was going to say, I want to really acknowledge, I love that Siobhan brought up and that you continued the conversation about talking about Gen Z and how they swipe books. And I would say the same thing, like my kids they're Gen Z. Yes, because there's a new generation, y'all, after there's the alphas. There's like a new one now.
Well, I know,
right?
I know.
But I do think that we have to think, and I haven't given enough thought to this, but to think hard about how we reach, how we influence, how we motivate, how we make issues of health, of Black health, of advancing health equity really salient for Gen Z. So that's just that's from a generational perspective. In terms of ensuring communication strategies resonate with diverse perspectives of African Americans, we need to think about it generationally a little bit, not to draw too big, not to generalize too much. But I would say I have three things that I think that we really must do to ensure that communication strategies are resonating with Black people and with the diversity of Black people. Number one, I think we have to embrace participatory research as the only way to do this well. And part of participatory research, one, yes, it's engaging people, but it's also conducting health communication research for, and then developing message materials, campaigns, interventions for social good. That is a key component of participatory research from my perspective and from literature as well, that it is done for social good. So I think that's one. Number two, I think it is critically important to conduct inclusive and equitable health communication research. At NORC, we talk about doing inclusive and equitable research, which is applicable across multiple disciplines, health communication definitely, and using I&E research to develop strategies. By way of a concrete example, that is research that acknowledges our own positionality as communication scientists, right? So yeah, I'm entering rooms, but I have to recognize my own positionality, my own power that I have or don't have in that room, my own biases, implicit and explicit, presumably. And also it is research, I&E research is research that centers culture and centers community and centers lived experience of people. So engaging them in research. And we've all talked about that a little bit already. And number three, the number three is related to including people with lived experience, but not only like in the data collection, but actually in the design. And I would also say in the analysis, y'all, and in how we determine how we're going to disseminate it. So disseminate information, health communication, not only health communication research, but messages and materials and strategies. So those are my three things, I think, in terms of how we ensure that communication strategies continue to resonate with Black people and with the diversity of Black people.
I love it.
Thank you.
I only have a little bit of voice left, And I'm gonna add just a short comment to that. So in my consultancy work, I do strategic planning with, tons of different organizations, and all of these organizations have a real priority for health equity. I mean, deep priority. And they care about their communities, whether they be in that community or be allies of that community. And they use research as the foundation. And so sometimes when I'm gathering insights about the organization, I am like, check, check, check. Representation, check. Are you disseminating and are you living up to your health equity standards and your priorities? Check. And when I see that there continues to be sort of a gap, we sometimes have to come to terms with the fact that if you really want to create messages that resonate, and if we really want to contribute to a more equitable society and be really serious about inclusivity, eventually you'll do all the things in those reports. But what I find is that when people, the staff, the people who run your programs don't have personal relationships with people who aren't like them, there is always something missing. And it shows up in the messaging. And so the way that you get to be really good at understanding a community is by being in close proximity with them. And that means that if there's a power dynamic where you're just serving them or you're studying them, but you're not really, you're not really invited in, then you're always gonna fall short. We as public health folks, as Black folks who are not expanding our own circles, we're always gonna fall short. And so I make it, my business to be friend. I mean, it's real basic. And I say this from experience of having worked with organizations that can't put their finger on what it is. Well, none of y'all actually know anybody from that community. Like, you work with them, you serve them, you study them, but there is no relationship. And so we have to make it our business to be in close proximity with people who are not like us, who we don't agree with, but who we still share values with. And that's even true when we're thinking about Gen Z and the Alpha generation, right? So, it's always a big thing for us to have mentors that are older than us or who are ahead of us, and mentors that are our peers. But if we're not really thinking about reverse mentorship, the idea of having someone who is younger than you, newer in their career, you have an intentional relationship with that person, because if you want to message out that, you can ask your kids, Gen Zers, my kids are, I guess I don't know, probably Alpha, but now I got to find out, right? But
I'm not claiming that.
the only way we will be able to make an impact is if we're in close proximity with the people who we say we want to include and we want to message. And it has to be authentic. And that's all I have to say about that. I just wanted to add that because that always seems to be the missing piece. And it's so hard to tell people that, but that is usually the missing piece because they will check all the boxes. So we've got to be in relationship.
Yeah, and I think that actually, to me, is kind of the fourth point, right? So Ashani talked about participatory research. She talked about inclusive and equitable health comm research, and then including people with lived experience. And I think the fourth kind of strategy there is building relationship. And I think as a point of that is also continuing conversation, right? Whether that's continuing the conversation in the frame of research to help move a message forward, or continuing the conversation where you're building relationship and engagement with those who need to disseminate said message or who are going to be receiving said message, so you can have that, to your point, that proximity, that touch point. We talk about that a lot in red flag testing and things like that, but I think there's something more to that than when you're talking about establishing a long-term relationship that will serve you over campaigns, over topic areas, over industry, because you want to have that pulse on what's going on and that connection point. And prior to this particular question, you all have talked about trust. We've talked about building and unpacking and just deconstructing misinformation. And a lot of that starts with relationship. And I think that's a really critical point. So I'm glad you made it. And you kind of answered the next question already around kind of how do we approach being inclusive and reflective. And so I know if there's anything else you want to add to that, feel free, but I know your voice is on a short time period. So if not, I will Stefan or someone else answer that. So, okay, that was your answer. Awesome. Does anybody else want to talk a little bit about how we consider diversity and approach? I know, Shani, you talked a lot about research, but I think, Siobhan, maybe you can share how you tackle that and put that forward in terms of inclusivity and perspective in your work.
Yeah, so I definitely like to lead with a cultural competence perspective, right? So making sure that we're thinking in terms of the values of the communities that we're trying to reach. A lot of what I do is really focused on, BIPOC communities. That includes the immigrant population and some things that we take for granted that like insurance coverage. Well, if they're an immigrant and they're not a citizen, they don't have necessarily access to it. So then that's preventing them from getting maternal health checkups when they're, doing pregnancy. So really just kind of understanding the nuances that and the challenges of their lived experiences. I think that is really, really critical if you're trying to really make a difference on the front line. And the other thing is, as organizations, being willing to do environmental scans. Like we say, oh, yes, we're going to do this. We're standing up to equity. And a lot of times, a lot of organizations do, especially when they have been able to build a community within their workforce that this is truly what they are there for and that is their purpose and that they're passionate about it. But then in other entities, there may not be that streamline, and underneath or underlying, passion and commitment to it. And so one of the ways that I believe is really a good way to identify whether or not you're standing up to what you have said you're going to do is to do environmental scans. Like, see what information you're actually pushing out there. See what information you are doing. How many times have you actually conducted a cultural competence training for your staff or for the public at large or for the, your clientele? Are you, making informed decisions based on the data that you're collecting? And is it reflective of the community that you're trying to reach? Because I think a lot of times we take for granted that the sample size is going to be demonstrative of the group of or the audience that we're trying to target. But in reality, I mean, if you only have one person that is a Black or Indigenous person of color, out of 100, then are you really truly getting a sample that's going to be representative of that, that group of people that you're trying to mobilize? And so I think that is really critical. And then the other thing is just keeping in mind the social determinants of health. I mean, I've heard a lot more conversations about it, nowadays, and people are more into it and understanding what it is, but really educating yourself and really taking a stand to say, hey, this is an area that I really want to focus on. And I believe that it's something that I can champion within my network, and then just do it.
I think the just do it part is probably the easier said than done
I
component of that
know.
statement. I'm going to let you end on that one, but
And
something else
just
that I want to
end
add.
it. And then
Yep,
just
I was going to say
tap it.
the thing that I wanted to add is put your money where your mouth is, right? Like, I think
Mhm.
that's the piece where we struggle the most is helping organizations and agencies recognize the importance of allocating funds to that understanding and to putting money towards including representation and increasing that representation and being reflective. And, Ashani talked a lot about the research component, as did you, but that also requires people thinking that's important enough to put money towards so we could have that research, right? And so you can have that understanding and evaluation of those programs and not stopping just because you put
Validate.
something reflective, right? So like, just because you put someone Black in an ad doesn't mean the ad's going to work. And it doesn't mean it's going to message people of color. Like, we have to be more cognizant of that and encouraging people to invest in those spaces and invest in Black researchers and invest in Black messaging and understanding that is a path that we need to kind of fund as well. So I think that's a good point that you made. And I want to talk a little bit about, as we wrap up, shifts and changes over time. I know we've all been in this game 20 years plus, so as we've shared in bios. So have you witnessed any shifts or improvements in how public health, whether that's agencies or organizations or entities, are approaching diversity and inclusion in their strategies, specifically when it comes to targeting African Americans? But what have you seen as the shift in SANS in the last few years, or even just the last decade, that is worth noting? And I'll let Siobhan start us off.
Well, I will say there has been a little bit more focus on bringing in the talent, the subject matter experts that have cultural competency. Like think about LaTroya, myself, because we have that voice and that reason that it's a lot of times overlooked. And I think that being able to really see, and think about things from a different lens is really, really critical. And I really like how LaTroya put it, just really building the relationships of those folks that are not just like you. And that is not the easiest thing to do, because we all want to, have this pride of being right and knowing things or whatnot. But being able to really just like be humble and hear from someone that is different than you, that has a different experience, it can really shed a lot of light and help you to achieve the results that you're hoping for. And so I believe that as long as we can continue to evolve our thinking around that, then we'll be headed in the right direction.
Agreed. Anybody else want to comment on that?
I mean, it takes all kinds of trauma to wake people up, right? So now, as opposed to 10 years ago, there's all this focus on DEI. People are really thinking about social determinants of health, and they are putting money there. But, like the grandmas used to say, keep living. Because when I talk to people who have been in public health for, let's say, 30 years, they have noted that there are these spikes where everyone gets really into, let's say, DEI. And then when the party is over, when the media coverage wanes, when some aspect of the population is seeing some wins, they start pulling the money away, and then we don't get to the finish line. And so even though, we are seeing so much, we're seeing progress. I mean, right now it's a different landscape. People are having these conversations more openly, and they're prioritizing DEI. But I think that we should approach with caution and not believe that it's going to continue this way. I think that we have to keep fighting, as though it's just, it can easily slip from our hands if we get too comfortable. So I mean, yeah, we're seeing changes, but I don't know. I don't know if it's going to last. And I will also say I talked to a lot of executive leadership, Black women in particular, who are saying we are seeing some strides for us, but we're having a hard time pulling up younger professionals behind us to keep the mantle going. There's no real pathway in terms of health communication and DEI work. And so I guess I'm saying that we have to keep fighting regardless of the strides that we're seeing. And one more thing. Sometimes when we get in spaces like this, we think that this is the norm. I was talking to a girlfriend of mine, also a UGA grad. I'm like, yeah, we're Black, we're college educated, we're married, we have kids, we live in a house, and we think that this is just like the statistical standard, and it's not. I just left a room full of fabulous grantees who are working really hard at the community level. And one of the women said to me after the training, she said, we just don't see people like you every day that can help.
Wow.
We don't see professionals represented this way. And they're working in public health, they're working on the ground. So we might think we out here, but we ain't out here like that. And so even though we see the strides from 10 years ago, we see an emphasis on DEI, and we see a great focus on social determinants of health, and let's really focus on how marginalized communities are being impacted. We're talking to ourselves most of the time, let's be real. And so we need to hang on to it and keep fighting for it, and recognize that also this is not the story across the country, and we have so much more work to do.
Yeah, I think you make a good point about the need to change the narrative. And we're often, when you have groups like this, we're preaching to the choir, right? We are in public health, we see these things, we are like-minded and like institution and agency. I think you make a really good point about, I think what we often see in public health, especially anybody who's been in it a very long time, recognizes the whole concept of flavor of the week. Like, this is the hot topic, hot trend item for now. And then, 2 months from now, something's going to come in and swoop away all of that. And so I think you're right for us to be cautious in this space. we are at the end of our hour, and I want to give you all an opportunity to share any closing thoughts you might have. But before you do that, I wanted to just thank everybody who joined us today and really appreciate your participation in this amazing conversation, and expect there to be more to come so we can continue it, so we stay a part of that, continuing the narrative in the right direction. So any closing words from any of you before we let our folks go?
I would love it if Ashana, you would provide some closing words because I feel like you have wisdom in your heart. But before, I want to say, Reginald Osborne, you are the winner. I randomly scrolled up and selected your name, so $5 gift card will be sent over to you. Thank you for being here. Thank you all for showing up. LaShondra, the two of you have your closing words, please.
Shani, you have the floor.
I will give, here's my closing words. I was trying, as we were talking, like, to tie everything back together. And so some of the words that Siobhan was saying about positionality, and then LaToya, you were mentioning some things about, that there's not a lot of us out here. So I was hearkening all the way back to the beginning of our conversation, and I was thinking about the challenge that I noted, which was the challenge of being the only.
Yeah.
I suspect that all four of us have experienced and experience being the only in the spaces that we enter, whether focused on health communication research, to develop campaigns and interventions, implementation, and or evaluation. I encourage the four of us and anyone else who is here and is listening and is entering those spaces to be consistently conscious of, one, your power and your positionality, and ways to share and uplift others in the field. So those are my closing words.
Thank you. Thanks everybody for joining us.